In this presentation, I will be reviewing Cluster B personality disorders. I'm your presenter, Tanisha Dell, founder and tutor of Envision. Cluster B is known as dramatic, emotional, or erratic personality. We also consider them as attention seekers. The personality disorders are borderline, histrionic, narcissistic, and antisocial personality disorder. Individuals diagnosed with cluster B disorders usually have shared impulse control and emotional regulations. Now let's first take a look at borderline personality disorder. Borderline personality disorder has a pervasive pattern of interpersonal relationships, self-image and affects, and marked impulsivity beginning by early adulthood. People with borderline personality disorder are unstable in their relationships, so they have difficulty forming and maintaining relationships. They are unstable in their thinking and emotions that change impulsively. These emotions can be anger, self-hatred, boredom, jealousy, anxiety, and so on, which are caused by either an extreme fear of being criticized, so they have these suspicious thoughts that people are either judging them or saying bad things about them. They also have extreme fear of being abandoned, rejected, or being alone. We often say that they tend to have a splitting personality, and this is black and white thinking. For instance, idealization, one minute you're their best friend and they have great admiration towards you, and devaluation, the next minute you're their worst enemy and they have this sense of anger and hatred towards you. Because of these emotions, their way of coping with their feelings is by engaging in some types of impulsive self-harming behavior, such as cutting, burning, as well as suicide attempts, having unsafe sex, or using alcohol or other drugs, which can potentially cause an overdose. They also struggle with their sense of identity, meaning trying to figure out who they are. Under stressful situation, they will experience what's called disassociation, and that is feeling disconnected from one's own thoughts and body. Some people may describe it as floating in air and watching themselves and others around them. Please keep in mind that because people with borderline personality disorder often struggle when a relationship is coming to an end because of their attachment and fear of abandonment, one typical example is during termination. It is important as social workers or therapists to set clinically appropriate boundaries with all clients at the beginning of treatment. Sustaining the boundaries set provides a much more healthier therapeutic relationship, focusing on the clients and their needs and the responsibilities of the social worker and the client. So, setting boundaries could be discussing scheduling the day, time, discussing the length of the session, which includes ending session on time. You should also discuss the frequency of the sessions, making contact outside of sessions, so talking about in case of emergency situations, any crisis, and if you're not available. Also discussing session cancellations and terminations and so on. With session cancellation and schedule time, clients may deliberately show up to session late or not show up at all without any notification. With termination, this process is very difficult. They may demonstrate splitting emotions during the termination phase, or they may stop abruptly when termination phase gets closer. So when ending a session or terminating with a client and they're requesting an additional extension or session hours, or requesting to continue treatment, you must follow through with ending the session or terminating as long as thorough assessment is conducted and the client is not at risk of harming self or others. We're also advised to discuss limitations to confidentiality prior to the provision of treatment services. It is unethical to report a client or have a client involuntarily hospitalized without explaining those limits in advance to our clients. Now let's take a look at histrionic personality disorder. According to the DSM-5, histrionic personality disorder is a pattern of excessive emotionality and attention seeking beginning by early adulthood. People with histrionic personality disorder believes that they're entitled to be the center of attention and are likely to be viewed as egocentric. So these individuals are considered the life of the party. They have to be noticed upon entering the room, and they feel unappreciated when they're not the center of attention. They have an intense need to be loved and desired, and if goes unnoticed, they tend to draw the attention on themselves. And this need for attention or approval may cause them to demonstrate sexual, seductive, and provocative dressing. and behaviors, regardless of the setting or who they're with. Manipulative behaviors, shift in emotions, overly concerned about their physical appearance, highly emotional attention seeking are all characterized by histrionic personality disorder. Their style of speech can be seductive in tone, overly dramatic and vague, and they're easily influenced by others around them. And because of their need for romance, they may perceive a relationship as being more intimate than what it is. Now let's take a look at narcissistic personality disorder. According to the DSM-5, narcissistic personality has a pervasive pattern of grandiosity, need for admiration, and lack of empathy beginning by early adulthood. People with narcissistic personality disorder think highly of themselves. In other words, it's all about them, and they feel that they are unique and worthy of special treatment. They're often preoccupied with fantasies, often exaggerates their realities and successes, and will talk at length about themselves and their achievements. They're unable to empathize with others' problem, which often strains most relationships over time. And people with this disorder are sensitive to criticism and will express anger and resentment towards anyone who criticizes them. Though they consider themselves as being superior than others, they tend to have an underlying feeling of inferiority and envy of others. Now, the last personality disorder is Antisocial Personality Disorder. The DSM-5 identifies 4 diagnostic criteria for antisocial personality disorder. And the first one is a pervasive pattern of disregard for and violation of the rights of others, occurring since age 15 years, as indicated by 3 or more of the following. 1. Failure to conform to social norms with respect to lawful behaviors, as indicated by repeatedly performing acts that are grounds for arrest. 2. Deceitfulness, as indicated by repeated lying, use of aliases, or conning others for personal profit or pleasure. 3. Impulsivity or failure to plan ahead. 4. Irritability and aggressiveness as indicated by repeated physical fights or assaults. 6. Consistent irresponsibility as indicated by repeated failure to sustain consistent work behavior or honor financial obligations. And 7. Lack of remorse as indicated by being indifferent to or rationalizing having hurt, mistreated, or stolen from another. The DSM-5 also noted as a part of the criteria that the individual must be at least 18 years and there should be evidence of conduct disorder with onset before age 15. Now let's take a look at our first question. Which is not a symptom of histrionic personality disorder? A. Excessive concern with physical appearance. B. Rapidly shifting and shallow emotion expression. C. Vague speech. Or D. Inappropriate or constricted affect? And the answer is D, inappropriate or constricted affect. This fits the diagnostic criteria for schizotypal personality disorder. This is a recall question that is without a case scenario and requires you to draw from your knowledge learned. Now let's take a look at the next question. A social worker using dialectical behavioral therapy as a form of treatment meets with a woman who states that she has been in multiple relationships and is having difficulty finding the ideal person. The woman informs a social worker that she thinks she found the right one. The woman also stated that he is very handsome, kind and loving, everything that she ever wanted in a guy. During the next session, the woman informs the social worker that she's no longer with him because he's a loser, and she's tired of him and complains about all the things she dislikes about him. Which of the following is the most possible diagnosis? A. Dependent personality disorder. B. Borderline personality disorder. C. Histrionic personality disorder. Or D. Narcissistic personality disorder. And the answer is B. Borderline personality disorder. Let's review the question to identify how we were able to rule out the other diagnosis. The social worker is using dialectical behavioral therapy, which is a form of therapy used for treating individuals with borderline personality disorder. Because individuals with borderline personality disorder tend to be emotionally unstable, they have extreme fear of abandonment, they often experience feelings of emptiness, often exhibit violent behavior towards others as well as themselves, causing self-harm, they are highly likely to have suicidal tendency. And dialectical behavioral therapy has been found to be helpful in reducing the risk of suicide. Another sign is that she has been in multiple relationships and having difficulty in finding the ideal person. Then we see signs of mixed emotions. On one hand, she found her ideal person, and then later on, he suddenly became a loser, and she started complaining about what she disliked about him. So it's that flip of a switch. As mentioned earlier, a person with borderline personality disorder has what we call black and white thinking. They tend to split objects into all good and all bad. So in this case scenario, all good means her finding a very handsome, kind, and loving man who is everything that she ever wanted in a guy. And then all bad is him being a loser and everything else that she dislikes about him. At this point, the relationship ends because she no longer sees the all good in him. So, for these individuals, if a person is not with her, for instance, decisions or her views, they consider the person as being against them. This creates a chaotic and unstable relationship pattern because it's either their way or the highway, and there is no compromising. Keep in mind that people with borderline personality disorder easily attach themselves to others, and then they can easily become angry and have hatred towards the person if they believe that they're either not getting the attention needed or being mistreated by the person that they care for or depend on. This tends to lead to them having an intense feeling of shame and guilt, and this constant emotional roller coaster often cause them to impulsively try to harm themselves. This is a way of escaping or numbing their emotional pain. Okay, now let's take a look at the next question. A social worker meets with a client who reports having marital issues. The client has been married to his wife for over 10 years and have separated twice. The client reports that his 50-year-old wife often wears evening dresses with high splits and high heels to any sporting events or even their son's school meetings. The client states that his wife is overly concerned with her appearance, and to please her, he often spends a lot of money on her clothing, which she never wears the same outfit twice. The client reports that his wife took her top off at a pool party and told him that she's still able to attract younger men who shows her more attention than him. Her friends since high school suggested that she leaves him and move on, and she's now considering filing for a divorce. The client appeared frustrated and states that when he asks her about the reason for divorcing him, she starts screaming, "You're the worst ever. I have to, and you know it," without making concrete statement. What should the social worker do next? A. Meet with the wife individually and refer her to a psychiatrist for medication to manage symptoms of narcissistic personality disorder. B. Suggest that the client have his wife evaluated for borderline personality disorder. C. Provide the client with education on histrionic personality disorder. And the answer is C. Provide the client with education on histrionic personality disorder. In this question, the husband is describing symptoms that fits the criteria of histrionic personality disorder. When answering case scenarios where clients are expressing concerns and highlight symptoms that their partner or their family member is exhibiting, it is extremely important for you to be able to pay attention to these symptoms and connect it with the correct mental disorder. Now, let's take a closer look at what is highlighted. 5 symptoms are required by the DSM-5 in order to diagnose an individual with histrionic personality disorder. The first symptom that we observe in this case scenario is that she often wears evening dresses with high split and high heels to any sporting events or even their son's school meetings. She's also overly concerned with her appearance, and to please her, he often spends a lot of money on her clothing, which she never wears the same outfit twice. So in this case, she's using physical appearance to attract attention. The next symptom identified is his wife took her top off at a pool party and told him that she is still able to attract younger men who shows her more attention. In this case, their interaction with others are usually inappropriate, seductive, or provocative. The third symptom, her friend since high school suggests that she leaves him and move on, and she's now considering filing for a divorce. So they're easily influenced by others. And when asked about the reason for divorcing him, she starts screaming, "You're the worst ever. I have to, and you know it, without making concrete statements. So we're seeing two symptoms here in one, being dramatic and exaggerating her emotions, and also vague speech lacking in details. Now let's take a look at this question. A social worker meets with a married couple who is having marital conflicts. The wife reports that her husband thinks he knows everything and does not listen to her. The social worker notices that the husband became angry at the criticisms made by his wife, has a grandiose sense of self, and lacks the ability to empathize with his wife's feelings. The husband states that his wife is just envious of his many successes and high connections with well known people. What diagnosis should be considered? A. Histrionic personality disorder. B. Narcissistic personality disorder. C. Antisocial personality disorder. Or D. Borderline personality disorder. And the answer is B. Narcissistic personality disorder. It is clear that the husband thinks he knows everything, which is part of the characteristics of a person with narcissistic personality disorder. He is sensitive to criticism and have a grandiose sense of self, which means feelings of entitlement. We're seeing impairments in interpersonal functioning, so lack of empathy, inability to identify with feelings and the needs of his wife. He also thinks his wife is envious of him and exaggerates self appraisal. In addition, he associates himself favorably with well known people, which gives that sense of importance. All these symptoms identified creates a conflictual relationship between his wife and others around him. And what you'll find is that these individuals are unlikely to believe that their behavior has relation to their problems. Now let's move on to the final question. A 25-year-old man was brought into treatment by his father after he was caught stealing from an elderly woman in a grocery store. "I am sick and tired of his behavior and attitude," the father exclaimed during the initial session. The father reports that his son has gotten into many troubles since he was young that had progressed over the years. He states that his son has a history of repeated instances from running away from home, starting fires, to destruction of properties, to engaging in frequent fights beginning at 9 years. As an adult, he has a history of arrests due to shoplifting, selling prescription drugs on school campus, forgery, and stealing cars. The son states, "I have no regrets, I'm just angry that I got caught doing it." The most likely diagnosis is A. Histrionic personality disorder, B. Narcissistic personality disorder, C. Antisocial personality disorder, or D. Borderline personality disorder. And the answer is C. Antisocial personality disorder. Usually, these individuals shows evidence of conduct disorder before age 15, and this is one of the criteria required to diagnose a client with antisocial personality disorder. Now, let's dissect this question and identify the symptoms. So we have a 25-year-old man who was brought into treatment by his father after he was caught stealing from an elderly woman in a grocery store. "I am sick and tired of his behavior and attitude," the father exclaimed during the initial session. People with antisocial personality disorder behavior often affect all areas of their life, such as their work, their school, family, and so on. Now, in this statement, the father is reporting that his son has gotten into many troubles since he was young and had progressed over the years. The running away from home, setting fires, destruction of properties, to frequent fighting is symptomatic of conduct disorder, which is, as mentioned earlier, is one of the criteria required to diagnose a client with antisocial personality disorder. The son states, "I have no regrets, I am just angry that I got caught." It is evident that the son demonstrated regular violation of the law. The son also shows lack of remorse and guilt for what he did and only feels sorry for getting caught. A person diagnosed with antisocial personality disorder performs actions that is unacceptable. They violate social norms and expectations without guilt or regrets. So, a few strategy tips. It is really helpful to put yourself within the case scenario and focus on what you are reading. Avoid adding to the case scenario or overanalyzing. Listen to clients presenting problems, concerns, and in this case scenario, being able to identify symptoms and connect with the correct personality disorder. I do hope you find this review helpful. Remember to think positive and visualize passing the exam. Visualize your future with your license.